Hey team, Dr. Josh Wagner here. In this quick training, I'm going to share with you why less patient education upfront equals more patient retention over the long run, which equals more collections, more profits, happier office, less energy expenditure with evening talks, hour-long report of findings, scripted robotic table talk, whatever it is for you that drains you when you see a new patient on the books thinking, I've got to get this person to agree with, accept, or understand chiropractic. This is one of the premises of patient mastery, helping docs become the go-to chiropractor in town with financial freedom, more time off, and less practice stress. So this comes from being on the phone recently with a doc who is so confident and so certain in his technique and gets great results, however, doesn't understand why he doesn't get referrals. People disappear really quickly, so he may be recommending, let's say, this amount of care, and people are getting results and bailing at this stage, which is frustrating. It isn't fun. And because of that, he has to put more energy, time, and money towards marketing stuff to get more new patients, and most of that marketing stuff is bringing in a lower quality of patient. So then that just has the wheel spinning even more. Maybe you can see yourself in this practice, in this type of practice. It's very common in chiropractic, and part of it, there's deserving belief issues, there's value issues, there's lack of patient leadership issues, but a lot of it is because so many chiropractors are conditioned to believe and think that patients need to agree with, accept, and understand chiropractic from the beginning in order to pay for care, refer others, and follow your recommendations. And I'm here to share with you, I'm going to share with you the background, the why, and the how of that is absolutely not necessary. It makes it tougher for you. It makes practice not be nearly as fun and enjoyable or easy, and it hurts patient retention, which hurts collections, hurts your profits, hurts your ability to knock out debts and build wealth for the future, let alone have 3-day weekends every single week. So let's start off with where this came about. Chiropractic started in 1895. From 1895 to, for the next 90 years, 85, 90 years, chiropractic didn't change in its, hardly changed whatsoever in its perception for the general public or its utilization. And we haven't changed in the last 25 years either. You know, we're still a small percentage. You know, you hear people talk, it's 12%, it's not even anywhere near 12%. But up from 1895, up until when insurance started reimbursing, which did boost how many people went because they didn't have to pay or didn't have to pay much, nothing changed in terms of utilization. And chiropractors weren't trying to get their patients to understand or agree with. They were considered fringe, super alternative, quacks, whatever. They were passionate about what they did, they got great results, and whoever came to them, came to them. Did people build big, huge practices? Without a doubt. What happened when insurance came in to chiropractic, let's say like late 70s, early 80s, that is when chiropractors started to be told that when you educate your patients, they will come for an entire year, or they will come for the 75 visits you recommend. Or remember when I was getting mentored, it was 120 visit care plans over a year. And we've got to sit with them for an hour, and their spouse has to be here too. And then they've got to come to an orientation class at night instead of having dinner. And we've got to convince them that if they're only going to pay this much a month, or only going to pay a copay, or you know what, we'll waive the copay, and you just keep coming in and bill extra to insurance, that's what's going to get people to follow the recommendations. And it was very easy to teach chiropractors this, hardly charge anything because insurance reimburses everything, and you'll have a full practice. And it absolutely worked. That's why they call it the Mercedes 80s, if you're not familiar. But here's the thing. The reason patients stayed, followed the recommendations, chiropractors were able to recommend a ton of visits, people did them. One, chiropractors are great people. It's usually like you look forward to seeing your chiropractor. 2, chiropractic works. So whether it's people are getting the results they came in for, or it just feels good, like it's a good experience. It's not like you're having to visit your accountant every day. And 3, when patients aren't paying, most people don't value their time much. Now, today's a much different society than 1980s and 90s with distractions. But if you're not paying, or you're just paying the $5, $10 copay, it's easy to keep coming 3 times a week for 6 months, and then 2 times a week for 3 months, and then 1 time a week for the rest of your life. And if the chiropractor's telling you that's what you should do, all right, like, nice guy or gal, it feels good, I'm getting better, and it doesn't cost me anything, I'll do it. Those were the 3 reasons why it was so easy to build a huge practice in the 80s and 90s when you recommended lots of visits and have high volume. However, chiropractors were misled to think it was the education that did that. Like, oh, patients understand, they get it, they agree with my understanding mentality of the spine and anatomy and physiology, and when we put this many adjustments in over this amount of time, things change. Like, yo, they get it, that's why they're following the recommendations. No. It had nothing to do with them getting it. And if you've been in practice long enough, or you experience those days, you'll know the patients who've been coming 3, 5, 7 years, you ask them, why they're coming. Feels good, because you told me to. They don't understand anything about the anatomy, physiology, subluxation, whatever it is you're doing. So when you realize that, things started to change in the mid to late 90s. And depending on your state, depending on your location, depending on the insurances you accepted, every year, it's most likely gotten worse. Yet, you're doing the same education, the same long report of findings, the same care orientation class, the same scripted table talk for the first 20 visits or 100. I've seen both. But the retention goes down. The referrals go down. The disappearances go up. You're doing the same thing now. Right there. That's the contradiction. It's so obvious. Not only that, the more you educate up front, the more it feels to a patient, a new patient, that I'm being sold, that I'm trying to be convinced, that I'm being closed. This feels like a timeshare pitch. This feels like a mortgage application, all this paperwork I have to fill out and how confusing it is with all these numbers and justification. The new patient, the customer of the 80s and 90s is extremely different than the customer and the new patient of today. They've experienced and seen most of the scripts and the language that chiropractic coaches teach chiropractors from many different professions, let alone other chiropractors. And whereas in the 80s or 90s, when it was their first time to a chiropractor and they didn't have to pay much, it's like, okay, I'll do it. Now it's, wait, I've heard all this before and my insurance doesn't cover. It's a totally different game. Patients can feel neediness, which is what most chiropractors have when your coach is saying, you need to see 500 visits a week, otherwise you're not a real chiropractor. Or you need to have your PVA at 95, otherwise you're not a good chiropractor. So chiropractors, first off, changing your mentality from neediness to unneediness goes from repellent to attractive. From I need the patient to agree, accept, and understand chiropractic, which they don't, to I'm gonna lead them to get what they want, not what I want, what they want, with the course of care that's gonna get them there. See the difference? A lot of times when I say that, chiropractors think, oh, well, everyone comes in and just wants to be, only see me once, never have to see me again, and be perfect the rest of their life. Yeah, sure, I wanna be 6'5" and, win the lottery. Like, everyone has that superficial want, but unless someone just comes to you like, oh yeah, my neck's a little sore, it started happening yesterday, they know that's not realistic. But there's a difference. When you show that you truly care about what they care about, getting back to their life, what's missing in their life, rather than you show how much you care about chiropractic and getting them to understand and agree with chiropractic, feels kind of culty. especially when no one else has told them this their whole life. Any of their other doctors, TV, newspapers, all the other stuff they believe is real. When you come from that place, it's repellent. It's, let me try it out, let me see. When you come from a place of you really, really care about how they feel, what they want, what's missing in their life, and what they want to get back, and you let them know that's what you're committed to getting them to, through a clinical protocol that you've seen work for countless patients just like them in the past, get the results they want, there's a whole different relationship. And going from educating, old school chiropractic, banging your head against the wall, constant patient disappearances, lots of, or hardly any referrals, and patients being frustrated with, oh my God, this exhausting report of findings, this scary report of findings, I have to bring my spouse, I have to come to an orientation, all this rigmarole jargon, to leadership, which is missing, has never been taught in the chiropractic profession because we felt like redheaded stepchild to medicine profession, because we don't oftentimes have the certainty in the results we're going to deliver, because we're here to adjust subluxation and the patient is here to get well and feel better. And sometimes those don't always correlate. So there's a lack of certainty. When you switch from trying to educate, convince, sell, and close, and go to actually being interested in what matters to that person, where they want to get to, and you showing them a super clear, simple, which doesn't have to mean short, like 2 visits, pathway to get there, that's worked for countless other patients with their same condition getting better based on your clinical experience and history, you will have people, again, when there's that emotional connection, and when you're talking in terms of what they care about, not spinal subluxation, getting the spine straight, proper nerve flow, stuff that they really don't care about, and they don't understand the gap, and they never will. When you go to that place, you will see patients happily pay for care, refer more, stay with your recommendations, even if they're feeling better or where they thought they should feel, let's say 1/3 of the way through. And I'm not saying to over-recommend care in any way, means, shape, or means, but some people feel a lot better and the symptoms disappear way earlier than the actual work is done and completed. Where? When you make that switch, that's what the 6-question patient mastery consult is for. That's what the 5-step recommendations, that's what the mentality shifts are for. That's what's how to increase your deserving belief. That's the expert paperwork, so it doesn't feel like a timeshare sale. It doesn't feel like a mortgage contract. More referrals, more retention, more payment, even if you're the most expensive chiropractor in town, because there's a connection they've never felt with any other doctor, let alone any other chiropractor. It is so common when docs do the patient mastery consult. So a consult is just a conversation. It's before the exam, it's before any care or treatment, that they're actually getting referrals just after the consult because the experience was different for the patient. When you go from connection and leadership, the experience is one that patients want to pay for, stay with, and refer to. When you're in this camp of convincing, educating, selling, that's when patients want to back up, not tell anyone, and when they need chiropractic care again, go to someone else. And maybe it's going to be an easier, gentler experience. If you want more understandings around this, watch the masterclasses, the 3 no-cost strategies I teach every chiropractor, first thing in patient mastery, on leading patients, what patients are paying for, how to actually charge for your care rather than charging for chiropractic, and the mindset switch from undeserving to deserving practice success. When you are making a difference in these patients' lives, which you are, when you're helping people get back to their life, which you are, you deserve to have an amazing practice and life yourself. if you're stuck in the old school jargon and dogma of chiropractic that you've got to see hundreds of people a day, you've got to get everyone to become a chiropractor. If they knew what you knew, they'd do what you do. It's not true. It sounds nice from the stage. It's a catchy slogan, but it's not reality. Patients need to be led. That's what they're asking for, wanting, and needing. Actually, they're not asking for it. They're asking for it subconsciously. They don't want to be taught and educated. If you want to make more money and help more people, you're over here. If you want to be banging your head against the wall, chasing new patients, always needing a lot more new patients, stay in the old school chiropractic education realm. There's a time and a place for education. It's not in the beginning when patients are stressed, anxious, nervous, fearful, and just need relief. Once you get them out of that phase, then there's a time and place for education. Is it going to make much of a difference? Probably not, but at least it's not going to turn them off. In the beginning, when they're just looking to be cared for, heard, understood by a leader, the education actually repels them. So it's not even like it's just wasting your breath and time. It's actually turning a lot of retention and referrals away. So if you're ready to take that next step, get out of that pond and jump into the patient mastery, like new era chiropractic, go-to chiropractor 3-day weekends, best profits ever. Check out the masterclass at patientmastery.com. First 3 steps, strategies, don't cost a dime to implement in your practice right away to become the go-to chiropractor, double retention, double collections. You need anything, I'm right here. Send me a message, and if we can help you, we absolutely will. Thank you for all you do and all the people you help and take care of.